All right, so I'm going to get started with that first question. Teresa, if you wouldn't mind answering this first, could you briefly discuss the accreditation, certification, endorsement, or certificate that INACSL has, and a little bit more about what it offers?
All right, so thank you very much, and thanks everyone for joining today. And if you have questions, please put them over in the chat for all of us. So INACSL has started the Healthcare Simulation Standards endorsement program. And what that is it is the ability for someone to submit an application to demonstrate that they're doing high quality simulations. Okay, we're only looking at high quality, and it is the core four. Okay, so it's not even all the standards. And the things that we're really looking at are the building blocks of having that high quality simulation that they had that you need to get the results that the NCSBN got in their simulation study. So the core four are pre-briefing, which includes the preparation and the briefing, facilitation, professional integrity, and debriefing. And one of the things that we hope that this does is be able to demonstrate and to show your leadership and to use other ways to demonstrate that you've had external validation that you can produce, conduct, and evaluate high quality simulations.
So is this for an individual or is it for an institution?
It's for an institution. We're not doing a person. The person comes from the certification that shows that they do that. Mm-hmm. And it is not looking at every single aspect of what simulation is and the entire program. It is looking at just the simulations within that program.
Okay, great. Shawn, would you care to share about your credentialing process that you have at ASPE?
Sure. Thank you, Amy, and appreciate the opportunity to discuss this topic area. Actually, ASPE has put forward a certificate exam, which is one of the newest initiatives of our organization. And it sort of aligns in conjunction with the development of educational resources for ASPE members. So over the past year, ASPE has developed what we are now calling the Center for ASPE Methodology, which will essentially be an online platform for housing curriculum for the professional development of our members. And in building curriculum or educational resources, we made the decision to attach a type of assessment so that we could give certificate or evidence of proof that, someone has gone through that curriculum, understands it, there is, competency in the content that was covered within that curriculum. So I think it was back in April or May, ASPE revealed the first certificate exam. And I say the first as there is a move to increase the number of exams as well as the number of courses that ASPE offers for its members. The first course, which is now live, it is on our website, the first course is entitled Fundamentals of SP Methodology. So it really covers those basic principles that all SP educators need to know, anything from recruitment and hiring of SPs to case development, to training SPs to deliver feedback. So all of that content area is included in course one. And once members have an opportunity to go through that curriculum, they can take a certificate exam, and successful passing of that certificate exam allows ASPE to then provide them with definitive proof of professional development. So we're really excited. This has been something that originated actually from member feedback. Is our members wanted educational resources. And so ASPE is very excited that we are in progress of supplying that for our membership.
Yeah, and just to be clear, the idea of your certificate opportunity is specific to human simulation, correct?
Yeah, that is correct. So it is all centered around SP methodology. So every bit of the educational content, as well as the certificate exam itself, is specific to SP methodology and all of the competencies there within. So.
Great, thank you very much. Andrew, I know that you have several things in Society for Simulation Healthcare has kind of been first runners in this. So I'd like to give you an opportunity to briefly describe the different credentialing opportunities that one has with the Society for Simulation in Healthcare.
Yeah, absolutely. And again, thank you for being here with all of my colleagues here. It's fun to be able to talk about all of this. We've actually been working on accreditation and certification. All that work started back in 2007 from the Society's perspective. It was our board back then decided that there was a big need for both of these products, and wanted to create them, build them out as a service to the healthcare simulation community. That's a very broad statement, of course, but it was recognized that accreditation for simulation programs was needed to help organizations understand what they needed to do to have high quality simulation. And there's a lot of comprehensive pieces to that. They created a very unique model. It's now the core-ARTS-F model, because they've added a couple things in, but simulation obviously is done through a number of different lenses, and our assessment, research, teaching, systems integration, and now simulation fellows activities are all addressed through the various standards, because again, there's lots of things that have to be done by individuals, by organizations, by the sim program itself. All are significant pieces of the puzzle to give out a demonstration of high quality outcomes in your simulation activities. And so that's what the accreditation program was designed to do, was to help simulation programs in all settings and for all learners be able to meet these benchmarks of high quality simulation activities. And so that's our first accreditations were granted back in 2010. And then certification itself launched just a couple of years later, because it turns out it takes quite a bit of work to put together exams that can be accredited. We're actually accredited through the NCCA, the National Commission on Certifying Agencies, and our exam-based certifications, the CHSE and CHSOS, are of course for the individuals within simulation performing either the education or operations specialist functions. And that's an important piece of the puzzle, because a lot of this, when we were investigating what was needed, was that 86% of our survey response for certification said everyone was learning on the fly. And that's not a great place for us to be as a profession, of course. And so you go back to why these were developed in the first place for the healthcare simulation community, and certification and accreditation. And obviously you're hearing about the certificate programs and endorsements. All these things are hallmarks of a profession. Yes. And that's why all the various organizations doing their pieces are helping to grow healthcare simulation as a profession. And frankly, to help us with understanding how we're going to have a higher profile in the healthcare community, in governments, and all these things like that. So lots of amazing things going on through all of our work together. Great.
So again, I appreciate that. And it was one of the things that I felt as though, as I was reading through the development of an industry, the credentialing process was something that was a little later to come, but it was something that was important to really get firmly rooted as a profession and as something that's being regarded, especially in academia. So I just wanted to ask, again, all three of you. So Shawn, we'll start with you with this question. Initially, why did your association decide to move forward with the credentialing programs? And I think that you've already addressed this to some degree, but if you would just take a minute to kind of, what was the gap? I think you said that your membership asked for this, but where was the gap, or where was the need that really began the impetus to what you're doing now?
Absolutely. Great question. And, I think what came out of feedback from the membership was that they were looking to ASPE as the organization to provide curriculum around the standards of best practice, I think is the easiest way to think about it. You know, SP centers emerge over time. They tend to branch off and build from core simulation programs within institutions that decide they want to have a more robust or rigorous human simulation arm. And there's very little resources before the Center for SP Methodology. There's been very little resource online for people to turn to gather knowledge, information, understanding, etc. So back in 2017, ASPE did a membership survey. So we surveyed the entire membership on where educational gaps exist and what content areas they would like to see curriculum built on. We had already learned from members through another survey that they were seeking, you know, ASPE's help in providing those resources, but we wanted to target what are those content areas. When you think about educational resources that could be provided to you, what would you like to see? And we got a robust response from membership, and that really I have to thank the membership because it really set the blueprint for how the Center for SP Methodology was going to come about. And, you know, one thing that I think also emerged from this is how important it is for us as organizations to always be listening for those needs and actually working with the members as we develop the initiatives and programs that we're going to be offering for them, because this fit that need that they quite openly expressed that we needed to do.
Yeah, so I am a longtime SP educator. So just to clarify, when you talk about the standards of best practice, INACSL has their core four in addition to many other standards of best practice. The ones that you're referring to are the ASPE standards of best practice.
Yes, correct. Thank you for the clarification. Yes, the ASPE standards of best practice. And so when you look at any of the curriculum that is now online within the Center for SP Methodology, each content area, whether we're talking about recruitment of hiring of SPs or case development or SP training, each of those content areas in that curriculum will align with the standards of best practice and explain that standard a little bit more. So it's almost like you get a double whammy by taking the curriculum. You learn the content and you learn the standards and how they apply to one another.
Yeah, understood. And just for again, those that are here participating in this webinar, both the INACSL standards of best practice as well as ASPE standards of best practice are all open access. So you don't need to be a member or you don't need to pay for access to any of them. INACSL, Teresa, I'm going to ask you to load up where they can access that in the chat. And then Shawn, as well as you, if you could reference the journal article. I think it's printed in 2017 in Advances in Healthcare. I should probably have it memorized because I've used it so often. But please do load that into the chat so people know where to reference those. Andrew, thank you. Andrew, I'm going to punt this one to you. Initially, why did your association decide to move forward with the credentialing programs that all of the ones that you outlined earlier, please?
I probably discussed a little bit of that previously. And again, a lot of it was about being a service to the healthcare simulation community to provide standards and structure for organizations to work towards and to achieve. And you can see all those on our website. We have our standards for accreditation, all those areas that are published, the core plus all the other areas. And for certification, it's about measuring existing competency and saying, do you have individuals who actually are meeting an external standard? And that's an important role of certification specifically, because it's very different from other products in that it's saying, what are you actually doing? What do you actually know? What are your actual skills, abilities, knowledge, and things like that? And so it's a measurement of that to an external standard. And that's really very important, and why it's such an integral piece of our profession, because we're just not, all sitting around a table and saying, do you think you do a great job? It's measuring to those external standards. And obviously that's the same way with accreditation, which is why we have our reviewers coming in and in a very partnering model with your organization, working through everything that you do, because simulation programs are doing amazing work out there. And so accreditation is a way to really get recognized for all that amazing stuff that you're doing. And we recognize that that was really important when we were developing this, to have that kind of attitude to approaching accreditation. And of course, also for certification, to say, look at the amazing thing that our simulationists are doing. And so both of those programs obviously were developed with that in mind, again, as a service to the healthcare simulation community. And it really just grow the community, grow our standards of performance, our external validation of quality, and show to the rest of the world, to healthcare especially, how simulation can be a part of patient safety, improving patient outcomes, all those amazing things that we all want to achieve.
Yeah, great. And I'm assuming that the accreditation standards are open access as well.
Yes, the accreditation standards are all open access, and our examination blueprints are also posted online and are available for free as well.
Okay, great. So if you could throw that up in the chat. And then I know also that there are some courses to help an individual who wants to get their certified healthcare simulation educator certification. There are some courses that are available that they can also tap into. So definitely, again, as I said, I think you guys were first movers and definitely seeing a lot of opportunity with that. But I want to make sure we get Teresa in on this question. And what gap did you identify, Teresa, with the credentialing?
When we moved to the endorsement, because in 2009, we really started working on the standards of best practice, and we had those, and then those continue to evolve. Then we've developed an education program, ISEP, International Simulation Education Program, that people can do. And that's to really help people internationally. It goes through different modules. It uses all of our standards. And once again, you know, we've all said it here, is that what we're trying to do is grow the people doing this, because we want the best outcomes possible. And we want some way to demonstrate and to validate. And so one of the things that we looked at and we listened to our members is that they really wanted a way to show, put that plaque up that says, you know, we are doing this right. We are using the standards, and this is, you know, the INACSL standards, which have been relabeled this year as the healthcare simulation standards. But that was the whole purpose of this, is to have it to where you can demonstrate. You've had somebody else review what you're doing, look at it and say, yes, you are doing this. You know, everything has always been compared to, well, in clinical, and we've all heard simulation doesn't work so many times that we get tired of saying, yes, it does. Show me where clinical works. You know, that this was one of the ways that we are building this body of science, and we're building the people to take all of these healthcare providers forward to provide the best care. And so one of the ways that we get these results is really looking and having people externally validate and demonstrate that they can do this. And so that's the gap that we were really, you know, going to look for our members. You're muted.
I had to do it at least once during this workshop.
Oh, yes.
For sure. If you have best practice workshops, I know, Andrew, I mentioned to you, or mentioned it, if you want to put a link to that in the chat as well, so that the people that are viewing can get a hold of where those workshops are and what is important to them, they can go ahead and access that.
So one of the great things is we have a workshop where all three organizations get together and do regional workshops. This is how collaboratively we all work together, is that we have these workshops that tell people and give them the, you know, kind of start building that foundation for them. And so we can put up those because they're all three together.
Well, that's great. I mean, that's true collaboration, interprofessional, interdisciplinary, and interassociational, I guess is the word for that. So I'm going to start with Andrew for this question, because you've been around a bit longer, so you'll be able to probably draw on a little bit more experience. But what, if any, unintended benefits has your association identified with the credentialing programs that you have?
There's actually quite a few of them, which are really interesting. I'm going to share just a few of the highlights. And when I look at accreditation, one of the continuous, and I could almost say every single program probably tells us this story. Accreditation from the outside looks very, very scary. I mean, I don't think anybody who's been through accreditation doesn't have that fear when they're going through it. But we have our programs that go through it come to us on the other side, and they say, "What an amazing process!" It was an incredible opportunity for them to self-evaluate, frankly, understand the things that they're doing really well. Because we're obviously asking for a lot of outcomes and how you're approaching those things, how do you learn from them, and they're able to identify the things they do really, really well. The reality, of course, is not everything goes like we hope, and so they can identify the things that aren't going quite so well, and we work with them to help give them suggestions through the review process, and they can implement those, and when they come to reaccreditation, they can talk about how they've implemented those changes and where they continue to tweak and learn, and that's a really neat benefit when you really think about it for you as an organization to be able to go through that. But one of the other benefits that really is interesting to see is how the team suddenly becomes so much more involved in that broad range of activities that are part of our accreditation process, those comprehensive bits that are through all of the SIM program itself, through what's required of the individuals, how you tie to the larger organization. And all of a sudden, everyone becomes much more aware of what's going on and become much more involved as you have a team approach going through and doing the accreditation. And one of the most important meetings oftentimes is when our reviewers sit down with the SIM program staff, the leadership, and we're with the organizational leaders, the vice presidents, CEOs, presidents of the college, whatever, again, your titles may be. And we get to talk in front of them about what amazing work is going on simulation-wise. And that is so important for the simulation programs to be able to hear that. And it's just been fascinating to see those things for the accreditation work that we do. And then when you look at certification, we got lots of tremendous stories through. And I'll just, again, highlight a few of them. But hearing, a new CHSOS say, that they're suddenly an equal player at the table just because of that new credential. And they're circled around with PhDs or take your pick of the various degrees that are out there, but they're now being listened to because they have those credentials. That's a tremendous story in itself. Hearing how people talk about how they've revamped their job descriptions to the examination blueprints, and suddenly, it's a much better functioning organization. Oh, guess what? It's led to reclassification of some jobs, and the salaries go up. That's great stuff as well. We love to hear all those sorts of things. And so, again, these are some unintended benefits that we don't have control over as an organization, but we have people reporting back to us. And so that's just some of the highlights. And of course, there's lots of others, but I'll hand it back to you.
Great. And I'd love to hear that. I think I'm not going to steal anybody else's thunder, but I have one that you didn't mention. So if Teresa and Shawn don't mention it, I'm going to mention it at the end. Teresa, I'm going to give you your chance.
Okay, so our new program, we just did our pilot and we've collected data from our pilot. We have started the process for the newest one coming up for the endorsement because it's done twice a year. And over half of the people said they learned something new about their organization. That once again, it's the same thing. It's mirroring what Andrew was saying, is that, they looked at gaps, they were able to identify them. People now have an idea of what they're doing, and that they are now using it to recruit more simulation faculty. That's to get the budgeting for it and to recruit people who are certified in there. And so that's one of the things, and it just gives them a sense of accomplishment. That is one of the things, is they say that helps them so much because they're recognized by their fellows as having a valid program. And that was, really looking at it, they say it gave them a bigger picture view so that they could see where they were going with it. And that intangible value in the teamwork members of the program felt throughout the process, working together to understand INACSL and the importance of alignment with the standards is invaluable. Bringing together members of our team to collaborate on aspects of the application brought new levels of professional and personal respect that will be reflected in our day-to-day operation. That was one of the quotes that we got back from when we did our feedback. So I think we're all saying, this is what we're getting, and that we're seeing a bigger impact because what we're doing is the biggest impact is what we're doing for the whole simulation community. And that is one of the greatest things. Thank you.
One institution at a time, right? All right, Shawn, I'm going to leave that question to you.
Sure. Yes, I like that, one institution at a time. Well, like I mentioned, to provide this opportunity for our members to take a certificate exam and get that evidence of professional development, we needed our own members also to assist in the development of those educational resources. So it became quickly apparent that we were wrapped up in, we wanted to get this curriculum online, get a certificate exam, but didn't perhaps realize the importance of the opportunities we were also providing to members for scholarly activity and their role in developing curriculum, the dissemination of curriculum. And so that has opened a doorway for members, especially ones who are looking for ways to enhance their resume or CV, things like that, to really be part of ASPE and really work to enhance what ASPE can provide to its members. The other thing that I will say is the development of online curriculum and the certificate exam has really opened the door for members, our international members, because many of them have reached out and shown some appreciation and gratitude for having this avenue by which they could get professional development. And the fact that it's virtual and it's online really aids in the process for these international members to get this education. So those were a couple of things that really stood out that haven't been mentioned yet.
So for me personally, because I've gone through the accreditation process and also gone through some of the exams, I think the two things that I think of off the top of my head is it really forced us to go back to our policies and procedures and evaluate what we had in our policy and procedures manual. We added to that policy and procedures manual based off of what the accreditation standards were. So it forced us back to the standards of practice, back to what the accreditation standards were. And the other thing that it did for us was it allowed for us to, Andrew, you mentioned bringing the leadership on, but it allowed us to appeal to them for certain things that we needed because that was following the standards of practice. It was following the accreditation standards. So we were able to beef up our staffing to meet that, because in the past it had been that at some point clinical instructors were to be coming in and doing simulation, and now all of a sudden that changed and flipped on its head because we had these standards and we had these expectations. So it gives us a vehicle to point to. I think the standards of practice are important, but that really it gives us really something to point to that's very significant and impactful along the way.
It's been really fun for our reviewers to sit there with that leadership and say, if only you gave them more staff, they could do such amazing things for you. So anyway.
Yep. And that, again, for those that are on the accrediting committee, it just puts teeth to what we've probably been saying for the last 10 years. So please keep doing that because it really does help us. So I would add those two things. So I'm going to go on to question number 4, I believe. Yes. So I'm going to go start with Teresa on this one. If you could deliver a message to every simulationist about your credentialing program, what would it be?
Do not try to keep reinventing the wheel. We've all done that, is that do this professional development. When we all started, we were learning on the fly because there were not all the books, all the resources, all the programs, and use the resources that are out there. As the biggest thing is find your niche, learn the standards associated with that, get yourself educated and implement that. And by doing that, then you want to be able to sell yourself and your program. And to do that, you do have to go through certifications and endorsements and accreditations. You have to do all these different aspects. It is a scaffolding that we're doing. And it is the better we do that, and the more these organizations collaborate together as we're doing, the better our community is going to be.
Great. Shawn, I'm going to pitch that one to you.
Sure. And actually, Teresa captured so many good things in what she just said. What I would add on to that is, this is an opportunity to delve a little bit deeper. We all have our own policy and procedures in our simulation centers or SP centers. How can we make sure that our current procedures are aligning to standards of best practice? And I think that's one of the things that ASPE members have really appreciated about our approach to this current curriculum where we've released is, it takes the thing we all do every day, like case development, but it gives you a model by which to assure you are aligning to best practice, which then is going to filter down and make your accreditation process much easier. And when you go give a talk at INACSL, it's going to align with their standards of best practice. So in some ways, I hope what people are getting out of this conversation as a whole is, even though you're seeing three separate organizations, we all have the somewhat same mission when it comes to this credentialing, and that is that you are adhering your policy and procedures to best practice. And I will also echo what you brought up earlier, or I guess it was Teresa, about the three organizations partnering and collaborating on best practices workshops. That's one thing that we've gotten feedback from those, is how we all intertwine and integrate with one another. And that's the big picture I hope people are coming out of this conversation today with.
And I have to say, Shawn, that was one of the intentions of having this panel presentation, is to show the cohesiveness amongst the team. Andrew, if you could comment on that, what would be your message to every simulationist?
Well, of course, the short version is get accredited and get certified. I mean, that's obviously where we start. But the reason behind it is because it's a way for you and your organization to have your practices validated to those external standards, which are developed through lengthy processes. You'll hear that about all of these things. They aren't just something that just get thrown together and put up. There's a lot of rigor, a lot of work that goes into putting these things together. And measuring yourself to those external standards is so important, and that's really what they need to hear.
Okay, great. Thank you so much. So you mentioned this just a little bit, Andrew, but I wonder if you would comment on this a little bit more. In your opinion, how does credentialing help a greater community beyond healthcare simulation?
Short answer to that is we develop all of ours, and you'll probably hear the same from Teresa and Shawn. The only reason we do our simulation is the same reason we develop our credentials. It's about the patient. That's the end purpose, ultimately, is what it comes down to. And if we're not doing great simulation activities, why are you doing it? Same with our accreditations and certifications. We develop those to support you doing great simulations to help the patients in the end. And that's really what this is all about, and why we have these programs, because that's where it really makes a difference. And that's why we're here.
Thank you. Teresa, would you like to comment on that?
So I'll continue on with what Andrew was saying, because fully agree with all of that. If we don't do simulation correctly, we can actually harm the learners, and then that does impact their care that they give to people. So if you can't do this right, don't do it until you can. And that is the biggest thing, is we want to have this to where people feel that they can make those connections, and that is, an environment that they can learn in, so that patients do better, they learn better, they have better outcomes, they don't get readmitted to the hospital as much. All of those is that if you look at your HCAPs and you look at all of those in the hospital, we can improve all of healthcare if we do this. And it's not just direct patient care. Sometimes it's the processes. Where do you put the crash cart? Where do you put the plugs when you're building a new emergency room? You don't know that. If you have standardized patients walking through, is it a good workflow, or do you find out you're having to walk through an area of a triage to get to the fast track? These are the things that we can do in simulation, that if you followed all these best practices, you're going to get better results.
Thanks. I have a local children's hospital that had built a new wing and they were all ready to move in. They'd recruited nursing students to help them move the patients from the old wing to the new wing. And the simulation director said, hold on, let's do some simulations. They delayed the move in by a month because they found a lot of really big glitches. So I agree with you. Again, it's not just about the patient, it's also about the workflows, the human factors, all of those things that go into it. But it was something that was really surprising to me to see that once you did a simulation of move-in day, wow, we really had to change some things before we were ready.
I think it was in Australia, they found out that where they planned on putting the crash cart had no plug. Oh, that's a big thing.
Yeah.
And if you didn't simulate it, you wouldn't know it.
Yeah, for sure. All right, Shawn, I'm going to leave that question to you. I'm going to repeat it just because we've gotten a little sidetracked. In your opinion, how does credentialing help a greater community beyond healthcare simulation?
Sure, thank you. And I can't articulate much more than Teresa and Andrew have already stated, but considering they spoke so well and recognized the overarching mission of all three of our organizations ultimately ties to quality healthcare and patient safety. But what we can do is always be there to support our members, give them the knowledge that they need to be effective at their jobs, to be able to provide evidence of obtaining that knowledge. And in the bigger picture, if we can do that for simulation and SP centers nationwide and beyond, those centers then can take that to their stakeholders, which will support those schools' accreditation process as well, because there is proof and evidence and programming that will assure those, those staff members or faculty members or even SPs are being trained at the highest levels possible. And so, ultimately it can benefit the schools by using our programs.
Yeah, and if you'll indulge me in one piece of advice from a longtime simulator that probably did do a lot of psychological damage before we had any standards of practice, is to find a fellowship. There are many fellowships within the simulation community at varying levels of ability or experience. So those opportunities, again, really afford you a mentor. If you can't get the support to go into a fellowship or you don't feel as though you're quite qualified, find someone in the simulation community. We are very open to sharing our own experiences and love to come alongside those that are excited about healthcare simulation and really encourage you to work on a mentor program or a fellowship, something along those lines. So the last question for today is many regulatory bodies for healthcare, for the health professions outside of simulation, still recognize simulation as a new or novel educational modality. In your opinion, how does our collective credentialing work to speak to its efficacy? And Shawn, I'm going to ask you to go first here.
Oh wow. Yeah, that's a big question. And sort of, I think one thing that stands in my mind as someone who also served recently in a School of Medicine accreditation is, how wonderful it was to see how much of simulation and SP activity actually emerged within that application. And not only did it emerge as quality training and quality assessment, but it also brought in a lot of interprofessional opportunities and activities. So in many ways, I see simulation as one of the resources necessary to assure wonderful or strong interprofessional curriculum within an institution as well. And what a wonderful resource that is. And so, I think by looking at it in that aspect and then bringing back the professional development opportunities and attaching value to the credentialing, it adds value to what we all do. It adds value to the fields. And really, I think once a lot of these regulatory organizations don't realize we have these, credentialing processes in place. Once they learn that, I think it will open some eyes and change the view a little bit on what we offer as organizations.
That is my secret hope, that some of these regulatory bodies see this presentation and are now open to the idea of all of the rigor that has gone into what we do in healthcare simulation. Andrew, can you speak to that question, please?
Certainly, and I think it probably echoes a lot of what Shawn has already mentioned. That these healthcare regulatory agencies, all these other external organizations are going to start to see what is going on, and they're going to see that it's not just we just put a mannequin out there or use an actor or whatever, take your bad example of simulation, right? All these sorts of things like that. They're going to see a lot of different representations of quality that they're going to have to take notice. And I think part of it, you can look at even just the number of organizations that are becoming accredited. For us, that stands at 237 programs from 24 countries. Or you can look at certification, and we're approaching 4,000 individuals from 43 countries who become certified. They're going to start noticing these things. Some of our individuals have even worked to get us the magnet designation for CHSE. And I don't know if anybody knows that on this call or not, but that's a huge deal, because that's now something that hospitals are going to start seeing for magnet designation, as individuals with the CHSE are going to be part of that report. And that, again, all those things are important, because they're starting to grow our presence in these external organizations, and that's where they're going to start to take notice and start to see the research coming out about the efficacy of healthcare simulation. We already know how valuable it is, how it works for clinical replacement and helps close those gaps down, how it can be used for those systems integration activities to say, will this work in healthcare? Why did we make these errors? Let's reproduce it and learn from what we're doing. And they're going to see all these things over time. And unfortunately, it's not overnight. We'd love that to happen, but we all keep fighting the good fight, because that's where it's going to make the difference. Again, supporting those great patient outcomes through appropriate organizational behavior, individual behaviors, learner outcomes, all these amazing things that we're all striving for.
Andrew, I hadn't heard about the CHSE being part of the magnet report, so that is truly exciting, fresh, hot off the presses, at least for me personally. Teresa, I'm going to give you the last word on this before we move to the question and answer session. Those of you who have any questions, please put them in the chat, and we'll begin that in just a few minutes.
So, I think that COVID actually helped a little bit of bringing the regulatory bodies to looking at what we can do to educate others. Okay. The biggest thing I can think of, even in the hospital, it was taking floor nurses or other people and training them on ventilators using simulation. And how do you get these clinical hours in? And I see that we're really coming that circle. I agree with everything that, Shawn and Andrew saying is, we started with the standards. From that, we said we all have to talk together. So we came up with the dictionary, and that was a collaborative effort. Then we went with the certifications, accreditations, and then we've developed more standards, and more people have developed standards. And now you even have the NOF, the National Organization for Nurse Practitioner Faculty, have standards for simulation. And they had always said simulation will not be part of the NP training. Well, now it's not part of the minimum 500 hours, but it can be used above that. So now they have introduced a standard to that. So we have those standards. Now you've got virtual scholars program. You've got you've got the NLN simulation leader, and you've got, these, the INACSL has a research fellowship, and then you have all, like I said, these fellowship. You've got the online courses that we have that everyone has to then lead on. And now we've gotten to an endorsement, which we just have conducted a webinar about the endorsement. And two of the people who are now endorsed told us in the meeting we just had that they are going for accreditation now. So it is, you see that it is not a one and done. And I think that when these regulatory bodies see that we are doing what is best for everyone, and then if this is done right, the NCSBN actually has simulation guidelines to get the best results. If we will use all these resources, they've got to look at it and show how we can really make a difference.
Well, thank you very much. I agree with everyone's sentiments, and I'm really excited to be able to share this in a webinar. Again, I will be fielding some questions in the chat during the live session, so we're going to pause here. Again, thank you, the three of you, for your time, talents, energies, and thoughts on this, and I'm very excited to be fielding some questions.